Okay, Dr. Garg, welcome to this seminar or a webinar, and we are delighted to have you here, and we are looking forward to hearing you with the research angle given in, because as I see it, you are in the research part of the healthcare activity. So a research bent to it will be a really different take on the subject. And over to you, Dr. Ritu Garg.
Thank you, Jer. So yes, as everybody said, that it's been an unprecedented time for us. And I think what stands out more than anything else, to my mind, is the resilience and our ability to adapt and innovate. I think what we saw in last 6-7 weeks, when we were almost under the deluge of this pandemic, which demanded us to change our flows and innovate at every step. And that's 360 degree. So right from patient experience to administrative to workflows, all of it. And as you said about new normal, I think every organization today is drawing up a handbook for what new normal will look like. And we did the same. From the healthcare branding point of view and research point of view, I think the things that really help globally is one, that the industry came together across the globe. What we saw was how many of our clinicians, doctors, administrators actually got in touch with their peers from Singapore, US, London. It was everyday conversation in the clinician group as to learn what the best practices are. And that helped shorten the learning curve for everybody. I think India got the chance to get prepared much faster. One, because I think we are good learners and we are also able to replicate best practices. I know that some of the things that were, implemented in one hospital, I think within a day they got implemented in 10 hospitals because it made so much more sense. And I think the collective learning that we have had, either in terms of clinical protocols or social distancing norms, or in terms of the safety of healthcare workers, has been phenomenal. And when we translate this to provide value to the patient, that is where the paradigm of healthcare branding will shift for all of us. It's pretty much back to the basics as to what do patients value. So obviously, they always valued the clinical excellence. They valued the ability to deliver best medical care. But today, they also value the sense and the processes that give them safety within a hospital. I would like to share an example, and that kind of for us set what a healthcare branding would be. So we had one patient who was supposed to be taken up for a kidney transplant. And of course, we were debating that, with so many, corona patients all around, should we postpone it? And should we look at the guidelines? Can it be postponed? Can it not be? And their patients, he comes to us and he says, but you know what, I feel so much safer in this hospital because I see that you have everything under control. Well, that is a big statement, and we just can't say that everything is under control, but at least what they saw and they saw value in was the fact that entire team was working to make the place safe in terms of screening, in terms of testing, in terms of disinfection, and that sense of safety and trust which was shown by that patient, I think is a testament to what the healthcare branding and marketing would look like even in future. So how we learn from each other and also adopt the best practices, be it in clinical research, be in clinical treatment protocols, be in technology, adoption of telemedicine, adoption of automation, robos. I think it's the entire process altogether. And in the end, if all healthcare facilities and hospitals are able to deliver that value to the patient, that he or she is in safe hands, and we do care for his or her safety along with delivering the clinical outcomes that the patient has come in for. I think that is what will be instrumental in this new normal, in the new world. It's no longer about one parameter. It's about the whole 360 ecosystem that we will have to work at.
I am going to go over to Ritu, and Ritu, you're on the line?
Yeah.
Okay, Ritu, my question to you is more, I look at it that COVID is not the first challenge that was faced by the public and may not be possibly the last challenge. How do you see the future post-COVID, and how do you see the public reacting, and how do you see things panning out? Because if other things are coming, how are we to be equipped, or how do you think we need to be equipped?
Yeah. So as you rightly said, this is not the first public health emergency or a pandemic. I think what will happen is that we will get smarter and adopt it in our way of life. Now, to give you a parlance of what happened when HIV was one of the infections that were identified about 2 decades ago. What it led to was a transformational in healthcare industry. So the healthcare industry moved from glass syringes to disposables. And HIV led to an era of adopting universal best practices in the hospitals. So we all learned to be more careful with needles, making sure that every healthcare worker has gloves on. It led to a lot of changes in blood bank because the carrier was through the blood. So the net testing came up, the concept of window period came up. So there was a whole host of safety measures that were adopted by all hospitals in that era to ensure the safety from HIV. And I think this similar shift is going to happen now. So what we have done and what we will continue to do is that we are now going to make multiple barriers, because we all know that SARS kind of illnesses can be there. We had swine flu, we dealt with that. There have been different kinds of respiratory illness outbreaks. And now with corona, this will become normal. So what will change? One, we will have universal best practices everywhere. Just as today we screen HIV for and hepatitis C for many patients during surgery, the COVID testing or an antibody testing will become a norm. Just as we started using gloves, I think the use of masks will become a norm for all healthcare workers. All OPD chambers, the billing counters will undergo a change. We have put in acrylic glass and plastic shields, to minimize the level of exposure of both the patient's attendants as well as our staff. So that will become a norm. It will become a norm, that the OPD chairs will be spaced out. The patients will come with OPD appointments to reduce the overcrowding. What I'm trying to say is that we will learn to live with it, and we will adapt our way of working to ensure the safety with this pandemic. I also see that with this, there's a lot of innovation happening in the OTs. So we are looking at how do we make our surgeons safe with aerosol generating procedures. So what I see is that going forward, there will be many negative pressure isolation rooms, both in the rooms as well as in the OTs. It will become a parlance. If I have to now plan the expansion of our hospital, I will make sure that we have adequate arrangements of negative pressure isolation rooms as well as ORs. So it will change completely to build in the safety that we require to be able to deal with these patients. So when you have one first episode of a patient who's not a suspect but gets tested positive, there is mayhem, right? Because you're running, everybody's running, trying to find out, do the contact tracing, so and so. But it will change to a point where we know how to deal with it. So no longer will it be panic. Okay, yes, there is a patient who was unexpected but has come positive. Okay, we will know how to deal with it in much more contained way. We would have evolved our contact tracing. We would have minimized the exposure to that patient, so that even if the patient or a healthcare worker or attendant is positive, it's not transmitted. And I think that way of working will become normal, and it already is. It already is. I mean, I think many people have adopted a lot of measures very quickly, be it the use of PPEs, be it the use of screens, masks, hand sanitizers. In couple of months, I think we would learn how to minimize the transmission and at the same time continue to work. And I think that is what we need to get to.
Let me ask Dr. Ritu, because she's short of time and she has to exit the event at 6:30. Dr. Ritu, in your view, how telemedicine is going to, affect the way administrations are happening, the billing part, the human resources part. How do you propose the use of geolocation to follow traces, etc.?
Yeah. So thank you, Rahul. I think the use of geolocation and, telemedicine is actually, government is showing us the way. I think Arogya Setu app is the best example of how you can use geolocation. Well, yes, of course, I'm not here commenting about the privacy issues and stuff like that, but we know that geolocation can help us understand the demographic profile of a disease in a particular location. Now, from a healthcare point of view, I think that also becomes very important. So when we start using our telemedicine, if there is a call which is coming in from a containment zone, from a red zone, then your reactions can actually be different than where it may be from other zones. And I think this is not just about this COVID outbreak, but it helps us to understand where the patient is calling from and what does the disease profile look like. We all know that there are different endemic areas across the world for certain diseases. So you would have prevalence of X disease in a particular location much more than any other. It could be to do with genetics, it could be to do with season. So our ability to pick that up is better if we start using geolocation. The second would, of course, be that with the use of telemedicine and remote connection, we are reducing the number of human interactions, which is much required in today's world. What that means is that everything is contactless. So what we are trying to do is that we are mapping the patient journey and saying that how do we make it completely contactless? So patient is sitting at home, they call us through telemedicine app, whatever platform that any of us are using. You understand where the patient is calling from. The payment happens before. Now during the teleconsult or video consult, if the doctor feels that the physical examination needed, even then there is a confirmed appointment which is shown at the gate. So they just scan the appointment, and this is what the future will look like, and you just walk in. So everything is contactless. You just go in, land in front of the doctor, and in fact, some people do video consults within the facility as well. So everything will move to automation and contactless and being contactless, and that is what we are going to use for our patient journey.
Thank you so much, Ritu. It was a pleasure hearing you, and I think you are in a hurry to leave. We'd have loved to have you for the complete session, but I'm sure we'll be offline again. We will be in touch with you. It was wonderful to hear you about the contactless process that we're going to have.
Thank you.
And I think I'm looking forward to interaction with you in the near future. Thank you so much, Ritu, for joining us.
Thank you very much. Thanks.